Jeremy, thank you. The number of COVID-19 cases in Kansas continues a steady trend upward. As of noon today, the Kansas Department of Health and Environment had logged 482 positive cases. That is up 52 from yesterday. So as more results came in through the afternoon, we can expect that we've likely topped the 500 mark tonight. You'll notice KDHE has changed its website a bit. Their map now has these color codings with the counties with the most cases highlighted in the darkest color. So that would be Johnson and Wyandotte counties, as long with Sedgwick County as well. The counties you see here in white have no positive cases so far. We also know a little bit more tonight about the 2 additional deaths reported today. Shawnee County health officials say a 79-year-old man passed away today of COVID-19. They say he did have a history of traveling to the Kansas City area. This is Shawnee County's 2nd death. Also, a 90-year-old woman in Coffee County. She's among 18 cases traced to a nursing home in Burlington, the first to pass away in their county. That brings the total number of deaths in Kansas to 12. Globally tonight, we are nearing the 1 million mark, 935,000 confirmed cases. Nearly 200,000 people, though, have recovered. More than 46,000 people have died from COVID-19. You can see a lot more areas of the U.S. now getting crowded with those red dots, more infections. More than 200,000 cases in the U.S., nearly 5,000 deaths in the nation. KDHE Secretary Dr. Lee Norman pointed out today that 78% of our state's positive cases have come from just 6 counties. He says expanding testing can help keep those hotspots from spreading.
Clearly, we need to do population studies, meaning testing people who are well, whether it's through a drive-through, and we're working with Johnson County to set one of those up. The limiting factor has been the number of test kits and swabs. But that will allow us to do very fundamental work, which is pushing the analysis upstream, so preventing people from becoming ill from it.
Dr. Norman says the major key to slowing the spread of the virus will always be social distancing. Governor Kelly added today that the state is working with larger companies like Mars and Research that provide essential services like food production. She says they're helping them implement social distancing practices and other safety measures in areas where workers simply cannot move further apart. A spokesperson for Mars told us today, we reached out to them. They say they're restricting the numbers of workers, contractors, and visitors at their plant. They're also taking temperatures of those who enter their facilities. In addition, Mars is intensifying the cleaning and disinfecting processes, and they say they're providing extra sick time to manage any quarantine situations. So how are we doing with social distancing? Here is a look at a report card. Unicast, a company that tracks human mobility data, used GPS information from mobile devices to track changes in how much people are moving around. Overall, the U.S. earned a C. The states that you see in kind of a bluish color, New York, Michigan, Minnesota, New Jersey, Washington, D.C., they earned the highest grades of A- for how they are limiting their movements. Let's take a look at the state of Kansas, and they actually break this down county by county. Overall, we get a C-. And Johnson and Riley counties, the 2 states you see in blue, they get A-, 2 counties. Shawnee County, we get a C grade overall for our movement. Those that are in the dark orange, let's take a look at the dark orange counties that you see all around the state. That includes Lyon County, Coffee County. They get grades of F. I'm going to be posting the link to that report card on WIBW.com. Shawnee County's public health officer, Dr. Gianfranco Pizzino, says if people begin to slack off on social distancing, we could see a greater spike in case numbers. He says the best way to keep yourself and your loved ones safe is to stay home.
People can infect other people without even knowing that they are infected themselves. People can transmit the virus before they exhibit symptoms, before they show symptoms. So, are you sure you want to be the one who's walking around town and he's putting other people in danger?
Dr. Pizzino does encourage you to get outside and enjoy sunshine, but continue to keep space between yourself and others. Also at her news conference today on the topic of social distancing, Governor Kelly said she's not canceling Easter, but she did encourage churches to keep in mind social distancing before inviting any large groups of people to congregate. Emergency officials are dealing with the dual threat of the COVID-19 pandemic and the start of severe weather season. Governor Kelly reminded people during her news conference to be weather aware. Yesterday, the Kansas Department Department of Emergency Management released guidelines on how to prepare for tornado warnings during the COVID-19 outbreak. Governor Kelly says even in the midst of high concerns surrounding coronavirus, we must know how to protect ourselves from a potential tornado.
Plan ahead and check with local officials to see if your regular storm shelter will be open. If you do have to seek refuge in a community shelter, try to practice social distancing and other precautions as much as possible to minimize your risk.
Emergency management also recommends gathering up any necessary supplies and reviewing emergency plans with your family. Even in the midst of the response, General David Weischer did take over today as Kansas Adjutant General. He will oversee now the state's Division of Emergency Management and Homeland Security. However, because of the current COVID-19 crisis, Major General Lee Taffanelli is putting off retirement. He'll stay on as an interim special advisor to the governor. Taffanelli served as Adjutant General since 2011. He's set to become CEO of Kansas Electric Cooperatives in May. Topeka's Stormont Vale updated tonight. It is treating 7 patients with COVID-19 and monitoring several more. CEO Dr. Robert Carnegie says Stormont has 47 negative pressure rooms available. They'll add 16 more in about a week. The hospital is seeing an average stay of 14 to 21 days for patients with the virus, so they want to be prepared.
That's a big issue for capacity. When you have very sick people that have very long lengths of stay, then it's difficult to free up those rooms for other patients. So a big gap that we're going to need to fill is an understanding of where those patients might be managed outside of the hospital.
Stormont also released new restrictions on visitors it will implement Friday. Those include only 1 visitor for moms and babies in the birthplace, only 1 parent allowed in the NICU and with pediatric patients, and only 1 visitor per patient in the operating room waiting area. Also, all hospital visitors and clinic patients must wear masks. The toll the COVID-19 pandemic is having on businesses and workers is shown in the state's unemployment numbers. Take a look at the bar graph. A lot of you have been asking about this topic. This week last year, the Kansas Department of Labor has seen only about 1,500 people file unemployment claims. The week ending March 14th of this year, it was around 1,800. Fast forward a week after that, the coronavirus cases started climbing, businesses started closing, and nearly 24,000 people filed claims the week ending March 21st. Last week, the week ending the 28th, 55,000 claims. By the way, this represents a year-to-year increase of more than 3,500%. It is also why so many of you are getting busy signals or being put on hold when you try calling. The Department of Labor gave us a little bit of information today. They received 877,000 call attempts to their unemployment line Monday alone. Before the COVID crisis, they had about 1,100 calls that they averaged a week. Today, the Labor Department told us a couple things they have done. They have increased the number of phone lines to 200, and they have added 40 intake workers. They are also training more staff from other areas to get more people on board. They also fixed a glitch today that was telling many of you filers you still had to wait a week for benefits. That was waived, so don't worry if you got that message. Also, they added a button online today. Several of you asked me about this. You can get your username and password recovered online. Some of you contacted me saying, I don't have it, I can't get through on the phone lines. You can now get it online. Labor officials say online continues to be the best way to file your claim. And again, that web address, getkansasbenefits.gov. Make sure it says .gov.
The sheer capacity, no one in this country or this world knew that this was going to happen. So we will continue working with you. We will continue listening to you. We see you. We hear you. We will get through this together. It will take a partnership.
New numbers tonight. Health officials say increased testing nationwide is part of why we could be seeing the numbers of COVID-19 cases continue to grow. Since 6 o'clock, we have now topped the 700,000 mark as far as confirmed cases nationwide. For Kansas, we went over 1,700 today. We're now at 1,742 this evening. That's more than 150 more than yesterday. Shawnee County is up to 90 confirmed cases tonight. Nearly half of those patients have recovered. And how is this for an update from Coffee County? No new cases today, but 8 more recoveries. That means 21 of their 45 are now well. Riley County did report 1 new case today. They now have a total of 27. Health officials there remind you that even though there is a lot of focus on COVID and how it's spreading, you need to seek help if you're sick.
Please remember that you can and should still access health care when you need it. We are hearing from some individuals that they are either nervous to get out for health care or they don't think that they should.
New models are out from the University of Washington tonight, and they show when states might be able to ease up on those social distancing measures. The lighter green states like Montana, they are actually showing that by May 4th, they might be able to ease up. Darker green should wait until mid-June or later. You can see that includes the states around us, Oklahoma, Nebraska. Their projections suggest that Kansas might wait until at least June 1st. But we also might be starting, according to the new projections, on the downhill side of the curve. When I showed you all of this a week ago, it put our peak at April 19th, Sunday. It is now expecting our peak use of hospital resources to have happened today, using about a fifth of available ICU beds, and it also projects the peak in daily deaths to be coming on Sunday. There's a little bit more detail in the report that they put out this time around. Now, this number that we have down here is a drop from what they had on the last projections. It is the total number of deaths projected, 187 by mid-May. Last week, that number was projected at 265. So some good news as far as what the overall outcome might be. And you can see the curve a lot flatter than it was a week ago. The Kansas Department of Health and Environment Secretary Dr. Lee Norman updated today that the state is following 35 total COVID-19 clusters. 13 of those are in long-term care facilities. There also are 2 in group living situations, 13 private companies. That's where a lot of the new clusters have been forming. Also 1 at a prison that is in Lansing, and the Department of Corrections put out new numbers tonight. It has now increased to 39 staff members, 30 inmates at Lansing that are confirmed, and of course 1 hospital on the list. We identified that earlier this week at Stormont Vale with 15 positive employees. 5 religious gatherings are where the other clusters are. And even as they keep an eye on clusters like these, state and local officials have another eye toward getting Kansas back in business. KDHE Secretary. The number of COVID-19 cases in Kansas continues increasing, but also the number of tests, too. We have topped 3,800 confirmed cases in the state since the pandemic began. We also have 134 deaths now as of tonight. Only 25 of the state's 105 counties report no cases. Those are the states that you see in gray, largely in the northwest portion of the state. KDHE today reported nearly 250 new positive cases, but also more than 1,100 new negative cases. Let's put a little bit of that in perspective for you. So 2 weeks ago, here are the total number of tests that were coming back. Monday and Tuesday of this week, that was up to a total of 900 new tests a day. And then here was today, those 1,100 negative tests, the 250-ish positive tests that came back. So that's more than 1,300 test results reported today alone. So you can see the testing rate increasing. According to KDHE Secretary Dr. Lee Norman, the state of Kansas is well past its case peak, and certain numbers are starting to slow down. 13's Isaac French heard his update tonight.
I think I can pretty comfortably tell you that we've peaked out in terms of the burden of the disease.
Kansas continues to report spikes in COVID-19. More than 4,000 new cases added to the total since Friday, with 17 new deaths and 61 new hospitalizations reported. Riley County told us about 1 additional death today, an 88-year-old resident of Leonardville Nursing Home. Health officials say they have a new outbreak there. The facility also dealt with an outbreak back in June. Looking at some of the trends, let's take a look at this red dot. That represents last week percent positive rating, 15%. That's up from 10% the week before. Looking at it in a little bit different way, this graph plots it out by day, and you can see over the past couple of weeks, the trend line has gone up. Shawnee County Health actually issued an alert over the weekend. They had 92 new cases confirmed Friday, 29 today. But take a look here as we put this up a little bit larger for you. You can see those tests that came back. This was Friday, 92, the most in one day in Shawnee County, 74 Saturday, 54 Sunday. Shawnee County health officials say that that those caseloads are causing delays in contacting people who are newly diagnosed. So they say if you are diagnosed with COVID-19, you get notified of a positive test, you need to isolate yourself in your home. Also, make a list and contact everyone with whom you have had close contact. That's spending 10 minutes within 6 feet of them from 2 days before your symptoms started, or if you didn't have any symptoms, 2 days before that positive test came in. Those close contacts also should quarantine for 14 days from the date of exposure.